Hello, Miranda.
Hi, Andy.
I'd like to talk to you about physician-assisted suicide today. Um, if you were to give a definition for what you think physician-assisted suicide is, what would you say?
Um, Situations in which people, people's quality of life is compromised, and they would rather, and it's better for them or their families to, in terms of quality of life, to no longer be alive.
Okay, and so in which cases would you say it is all right for a physician to perform these procedures? There's different types, and there's different variations of this. The most typical one is that a physician will administer a prescription for a lethal dose of a pill or something that the patient will then administer themselves. But there are other forms, such as terminal sedation, which refers to the practice of sedating a terminally ill patient to the point where they're unconscious, so they can't feel themselves dying, but there's basically no return at that point. There is withholding life-sustaining treatments, which means if you're in the hospital and you don't choose to live any longer, you can basically be on the do not resuscitate list, and then you'll die. Or pain medication that might lead to a faster death, in which you are prescribed medications that will make you feel better, but they're unhealthy for you, and so you might die faster. And ethically, do you have any issues with any of these procedures?
Um, I think for me it's really just from kind of as that is pretty much my only education on this matter. It's just ethically, I think that the patient should have the choice. It should be their choice, definitely. And if the patient is unable to communicate their choice, I think it can be on the family. But I think like the family should be confirmed that the family is like sane and like looking out for like the the best interest of the patient. Let me try to remember what you said. No, I think if your quality of life really is compromised, then sometimes it's better to die. It's a difficult topic.
Yeah, and so if you were to say right now whether you were more pro or against assisted suicide and euthanasia, which would you say you're leaning towards?
I'd say pro, just considering that it's handled in a very professional way, and patients are 100%. It's 100% up to the patient, and if not the patient, then they're confirmed to be, what's the word? Confirmed to be capable family. Yeah, in terms of that decision.
Okay, I have an article here. It gives both sides, and so you brought up the points that the pro euthanasia side of the argument says, such as freedom of choice, that a person has the right to decide what happens to their own body, and that it's already a legal, widespread activity that happens sometimes. So I'll just read to you some of the points against, just to see if that opens your eyes or anything. There's the religious argument, which is that these practices cannot be justified for a religious reason. There's the slippery slope argument, which is based on the concern that legalizing euthanasia could lead to unintended changes in our healthcare system that we might later regret if this becomes too widespread. There's the medical ethics argument, in which asking doctors, nurses, or other healthcare professionals to carry out a euthanasia or assist in a suicide of a patient, that it might be a violation of their personal ethics. and the fact that there is no reason for a person to suffer mentally or physically because an effective end-of-life treatment is available. So euthanasia is not a valid treatment option, but represents a failure on the part of the doctor involved in a person's care. So, do you have any response to those arguments?
Well, religiously, I think that's up to the individual, and I don't think that any religious viewpoints should keep other people from making their own decisions in terms of legislature or whatever. That's your call. It's not anyone else's. It shouldn't affect anyone else. In terms of doctors not doing their, not, what was the wording, not being able to, it's a failure on the part of the doctor. Some lives are going to be lost, and doctors can't save everyone, and it's not a failure. It's just, someone is terminally ill. Someone is, a vegetable, if that's a politically correct term. A doctor can keep someone alive maybe, or a doctor can make something as painless as possible, but when it comes down to is whether the person, is their quality of life is still worthwhile for them.
Okay, and that brings up the argument of what situations this procedure should be used for. Obviously, it's used in the cases that a person is past the point of return, but there's also the argument that someone who is clinically depressed should have the right to choose to end their life via doctor-assisted suicide because it would be more humane than attempting suicide themselves. Where do you fall on that argument?
Well, I disagree because I think that someone who is clinically depressed may be suffering, emotional or mental distortions from reality, and that to me is a situation that can be recovered from in almost every circumstance. And often someone who thinks they want to die, they might be distorting reality or, in an emotional state of mind and not be able to make that decision for themselves. I think as long as, there's therapy and, any kind of, inpatient situations in which a person can be helped, emotionally, mentally, then, that there should not be any doctor-assisted suicide in terms of depression.
Okay, and any final thoughts or statements about the matter?
No, but I think, well, yes, I guess. I think every individual situation is different, and if there is to be legislature or anything on this matter, or there already is, but it should be really, really clear and individualized, and every situation is different, so it's obviously a really difficult topic.
All right, thank you for your time.